So as of about a month ago, over 1,800 pieces of equipment have been distributed. Well over 800 people in the Commonwealth have been served. It has 714 here, but talking with Jimmy Brown, who helps oversee it, we know we're over 800 folks that we have helped provide this equipment. One of the issues that popped up and the concerns was, would the durable medical equipment companies see us as competition? The opposite actually has happened. So when Gould's Medical in Louisville is turning over their inventory, they're sending it to us. So we're getting truckloads of equipment coming out to us. So if you need, we have enough canes now that I could build a really sizable treehouse with nothing but canes and wheelchairs. We just have another big load of them to come out to. So no, we are not seen as competitor. The durable medical shop for ARH partners with us heavily because they go, do you know what? There's certain people we can't serve because of insurance, but they need the equipment. We know we can get it through you guys. The downside for my poor students is when we had our first go around, I mean, we were having to do serious rebuilds, get in there. Now the equipment is so good, they don't have to clean. I mean, it's like they're not getting the MacGyver anymore, but that's okay. We had one piece of equipment in Hazard 2 days ago that was in inventory for under 22 minutes. It was almost pushing it down the hallway to clean it and get it out the door. And it was a nice big electric chair that we got down there. So once again, and as Beth had mentioned, Sheila Levy, who is the director of CARET, now is co-listed at the state with the Emergency Preparedness Group. So now the other kind of group we are now working with is FEMA. So when there are disasters and people need equipment, FEMA contacts us and we get the equipment out to them. So it's one of those things, it evolves. You never know where things are going to start to go, but if you keep your eyes open for opportunities, it's amazing what's going to happen. Okay. And here are some of the Project Carrots. So if you go to projectcarrot.org, it's a website. You can find out what equipment is available, what site you can find it in. You can make requests. We also have Sheila Levy's contact information on here. Or if you can't remember anything, email me. I'll link you in because I run one of the sites as well. Okay. So before I go on to the last step, does anyone have any questions about our Navigator program or Project Carrot? Yeah, Project Carrot has been one of those that's been really interesting on trying to find the sustainability for that one. It's yet another one of those, everybody loves it, everyone utilizes our program, but no one wants to pay us for using it. So we've come up with very creative financing for that. The nice thing about the site that we have in Hazard is since the students run it, you don't have to pay for the workforce, and the center has been so generous as they have paid for our storage facility. So it's pretty much free of charge down there. Lourdes Hospital stepped up and they're a good partner and they've paid for the facility out in the Paducah area. Working with Spalding University, they use students as well. And Bellarmine University now is partnering with Spalding to be part of Project Carrot. So it's once again, you can come up with really cool ideas, but then sustainability is always a challenge. But we refuse to stop because we know it's having an impact.
How much space does it take?
It takes a lot of space because we have and it depends. Our space in Hazard, because we don't store power chairs, because we don't have to, because we have power chairs over at Carly Perkins. So that's close enough by, and they have multiple chairs set up, and they use it as one of their training tracks over at Carly Perkins. But what we're trying to do is set up some locker systems in different places. That's all they do is they store a certain amount of wheelchairs, walkers, and that, so that it's a little closer to the community. So we have I think it's currently a 15 by 15 foot space in Hazard that we've got pretty filled up.
And besides space, it's also being able to move this stuff around. So someone says they're going to donate a bunch of hospital beds, well then that has to be arranged to get them to wherever it needs to be. So I know Sheila is doing a lot of work with that.
Yep.
We have a question online.
Yes.
And the question is, are you able to assist with transportation of those wheelchairs to reach clients who do not have transportation to collect it from?
Excellent question, and we are currently working on different models. So if we know people are moving back and forth, so if I have people from Kentucky Home Place that I know are going out in the region, if I can get it to the coordinator out to that, I can get some equipment out there. We have worked deals with is it FedEx for just bulk rate, really cheap to get things shipped across the state, because we did our very first one from Paducah all the way out to Hazard run. It got a little creative, but we found our way to do it. Yes.
Before we ask another question from the audience, I want to plug it into the microphone so we can hear them better.
Okay.
Okay.
Please.
Okay. Yes, question.
Going back to KC3T, you mentioned educating families and caregivers and being in health and wellness. That's so important. I was just wondering, what kind of platform have you guys? Do you have an idea of how you would do that, or?
What we are doing currently is kind of the standard Keisha in the home going over handouts. The platform we are looking at now as part of the grant that we're currently writing is exactly how do we provide this, is we are looking at utilization of tablets that are preloaded that can be very individualized to that person. And the thing is, tablets now, we just went on Amazon for Christmas for $30 a piece. And if you can have everything preloaded on there, do you know what? Why not hand that to the person as they're leaving your facility to go back home, instead of a big stack of papers that they're not going to read anyways? So that's exactly what we're looking at. And can we put text as well as very culturally developed videos into it, so that they understand it better? We want to definitely get our videos on for the transfers, because if you were lucky enough to have one caregiver come from Eastern Kentucky into Cardinal, you were lucky, and you might have trained them how to do transfers. The majority of the people doing transfers back home have no training at all. So how can we provide that? We know that there are many places out there that my GPS doesn't work, my cell doesn't work, so we can't go internet yet. I know SOAR, the Shaping Our Appalachian Region movement from Congressman Rogers and two different governors is trying to bring broadband out there, but even with that, many of our people won't. But we can have it MiFi linked into it, so that we can collect it and provide the opportunity for the people to have access to Keisha or whoever we do that, so they can ask questions. So that is an excellent question, and we're currently working on that NIH grant right now, and I'd be glad to talk to you more about that. Yes.
Carrie, do you take individual chairs?
Absolutely.
I've got a friend that's got a couple sitting around that are rather old.
Yeah, no. Walt has been a transport system many times there. My wife used to grumble because the sad thing is, so much equipment was going to the dump. You go by there, all these chairs, walkers and all that, they just went to the landfill over and over again. No, let's recycle it. That now, even if it's pouring outside, if we're driving down the street and we find something, I stop and I get out and I put it in the trunk, and we find a way to get it out. Because that just isn't acceptable. And do you know what we found for part of our sustainability is, if we have some equipment that is just a wreck and we can't do it, We scrap the parts. We scrap the parts, we scrap the aluminum and that, we get the money back and it helps pay for parts. Especially now that we get to be a whole lot more selective because we're getting such good stuff coming in. Rockcastle Hospital, I think 2 years ago, did a complete overturn of their wheelchairs, especially their pediatric chairs. So we had 30 some of those that they donated through, and those went through really, really quick. Yeah, and seeing as sometimes this is just temporary, some people just need it for a short period of time. When they're done, they donate it back. Okay.
And you get a nice tax write-off too.
Yep. Yep. Any other questions before I go into our very last ongoing study, which is hopefully kind of bringing all of this back around, because we started off as how do you engage the community? And more importantly, how do you engage them to the point where they help you ask the questions they need so that you can be the most helpful to them and helpful to their community? Beth and I recently received this grant, a 2-year grant from the Patient-Centered Outcomes Research Institute, PCORI, one of the national funders, to examine exactly how do you engage people in the rural communities, especially individuals with stroke, spinal cord injury, brain injury, and their caregivers. Okay.
So it's called patient-centered outcomes research. The underlying philosophy is that all that we've been talking about here, any kind of research really needs to come from the end user, because we've spent tons and tons of time and money on research without really talking to the people that use it. So just because it might cure something, it doesn't fit in their lifestyle, they're not going to use that medication anyway. So this is, the goal is they want us to reach our special group, this rural and Appalachian and neurologic disabilities. Let's hear from them. How do we engage them so we can start hearing what kind of research is important to them? So it's all the stuff we actually started with.
Yeah. But now we're formalizing it so that it can be packaged and be used across the United States in different environments. And it was because of this that I got the phone call from the group out in California to figure out how do you do it in the rural community as well. So we started this off, and we're at the end of year 1 of a 2-year project. So we have done a lot of very targeted interviews with individuals across our conditions and that, asking what is important to you? What I think might be your most important and pressing healthcare need. They go, no, my most important need is X, Y, and Z. So let's get on the same page of what they think is important to them. Where are they getting their information from? Because this is the area that's been terrifying for me, especially in the stroke world, is there is so much disinformation in the rural communities that is causing a lot of problems. Where we have in some of the smaller communities that the thought is, you've had one stroke, you're automatically going to have the second one that's going to kill you. So you have people going home just waiting to die, which just appalls me. And it happens over and over again. And I've had plenty of sit downs in living rooms cleaning up that misconception. The reason why we did the rehab on you is so you could get back home and get out. I want you back in your garden. I want you out hunting. I want you doing all this other stuff here. So where are you getting your information from? And then we're trying to build the team. What we're doing starting next year is we're going to start to do some focus groups. But as part of the focus groups is we are now using all the different ways of recruitment. Recruiting with flyers, recruiting over TV, over radio in the rural communities, libraries, social media, to figure out, if you're working in the rural community, how are these people even going to find out if you have a study to even get them to the table? So that is a huge part of what we're going to be doing this next coming year is what are the best way. We all know if you just hang up a flyer in a clinic, 99% of the people will never look at it. You might get that one group. How do I get to Miss June? So I'm also going to be meeting with the ministers associations out there. How do you get the word out to start to recruit people to be part of the study? Because that's the one thing PCORI is wanting to know, and that's what most clinical trials fail so miserably. Even at the NIH levels, you can't recruit anybody because you haven't figured out how to do it. So instead of doing 20 different ways, if I have a limited amount of money, what are my top 4 ways that are going to reach the most people to bring them in? And then once we bring them in, how do we move them across the continuum so they become part of our research team? So after the focus groups, okay, and finding out how do we get them to do clinical decision making is we're going to have a one-day, half-day event, I should say, next August, where everyone's coming to the table and say, all right, you're the people interested. You're now our research team. You're going to help us ask the questions that are relevant. And we will write the grants and we will find the money to figure it out. And then in hopes that then once we find out the information, they're also going to be the ways the people that are going to help us get the information back out into their community so that we can actually move the needle at the community level.
And these PCORI grants are set up in a way where you can take each step. So there is another grant mechanism with PCORI we can go for after we have all come together and built consensus on what it is we want to be looking at this first go around, and then we will apply through them again.
But once again, the way we were able to start with our targeted, these are all people we got to know over the last 8 years.
Yeah.
They are part of our team. We now have a stroke support group out in Eastern Kentucky that now we have those people who are part of it. And actually we had one person, without us even asking, raised her hand. She's a caregiver and says, how do I become part of the advocacy? And Violet, Sylvia, and I, we just looked at each other and said, the fact that you're sitting around the table here, you just became part of the advocacy group. So welcome to the team. People want to be part of it. They just need to know how and at what level. And as part of this, as Beth had mentioned years ago, we had created our Research 101 modules. We've completely revamped them to do teaching, to teach people what is research. It's just asking a question that is relevant to you. It's doing it in a very systematic way so that you can look at the results, but it's just asking a question. You don't need a white coat to do it. In fact, if you have the condition, you understand your condition better than I will ever know it. You know what's important to you. Help me understand that. And it was funny when we developed our Research 101 modules, we had it on our website, but our huge Center for Clinical Translational Science here at UK, they also took those modules and put it on their website too, of how do you teach the community to be part of the team. And this is taking to the next level and really analyzing how do we get out there, how do we work with our coalitions to engage the people and not only just get them interested, but have them become truly the partners to help us ask the questions. And on the PCORI grant, 2 of our actual researchers on here are community members. One of them, Violet Sylvia, is the Systems Director for Rehabilitation Services for ARH. The other one, Carolyn Wallace, is a mom of a son with a TBI. She brings an incredible perspective to what we're doing. She says, here's our reality. So she's a great fact check for us. So this kind of grant is kind of really encompassing what we want to do as an organization on top of everything else.
You mentioned SOAR earlier.
Yeah.
How are they involved in your grant process?
They're not, but I know members of SOAR. Through other hats that I wear, I know people from the Appalachian Regional Commission. And in fact, what I'm hoping to do next week while I'm in DC for a meeting is actually meet with several of the key people from SOAR.
Yeah, I mean, they're so focused on workforce development.
Yep.
Why couldn't all this with the CARET project be used for workforce development for individuals with disabilities?
Yep. No, I agree. So we're getting on the agenda for several of the key people for SOAR to have some discussions, but hadn't even really thought about the Project CARET side of it because we got so many other sides. That's an interesting idea. Other questions?
Is there a database of research questions that your clients have asked that, I mean, I'm thinking about, we've got a lot of research assistants and students too. And, we're always trying to generate research questions. I assume, I mean, you guys have busy agendas and everything. You probably can't get to every question that's been asked.
Would love to work with you on that. Yes, we do have some, and we're developing even more next week when we have, we're having a mini retreat for Karen next Tuesday, where we're getting everyone together prior to our annual holiday lunch that I like to bring everyone together. And we're going to really hash out some of these areas. as a group, where do we want to move over the next year? What directions, what topics do we want to cover? And we do that every year. And then, as Beth said, accountability is a huge part of it. So every year I contact all of our partners to say, have we met up our part of the bargain? Do you feel it's worth being part of our team? Yes or no? Because if not, then we have failed as an organization. And we do take accountability very, very serious. So if ARH or BIAC or MS Society or our community members don't feel that we're doing anything to be helpful to them, I want to be called out on it. I want us to change and move forward. And that's why we're having this mini retreat, is to kind of focus what we're going to do over the next year, next 2 or 3 years here. But yes.
And then, well, also with the PCORI, I mean, that is kind of the goal of that project. And we've gone through, as Pat said, the first year, and we have our first wave of data, and we're in the midst of analyzing all that. And it's interesting because, we are coming from different perspectives: spinal cord, stroke, TBI. And so there are a lot of differences in what those groups are prioritizing or interested in. And yet there are a lot of things that translate through all three. So at this point, we're going to try, most likely, to focus on something that's going to affect all three groups so that we can keep everyone kind of involved. And access to care is the one that, of course, is rising to the top, but it's really in an interesting way. Things that I hadn't thought about. So we've got access to primary care, which is a big deal. And we see with the stroke group that has had the navigator help, that's been a huge success. The other groups haven't had that navigator help. So getting connected with primary care, then the specialist issue. How do we help the primary care people out in rural communities not be afraid of certain diagnosis and get the people connected to them? Then with specialized care, is there some sort of education we could be providing? But then one that's come out very interestingly is this complementary and alternative medicine, and whether people have access. So in Lexington, we have family members people are getting acupuncture, they're getting craniosacral therapy, they're getting massage, they're getting herbal. I don't think a lot of those services are going to be found in Eastern Kentucky. I don't know, we haven't looked. But so it was an interesting kind of three-pronged thing that's come out. And then a big component of that is, how would these, say in a perfect world, we get them connected, what's the communication that's going to happen between the family, the person, and all the providers? So something is developing right now in that area. We haven't got a question yet, but.
No, but I mean, we are limited by the number of people we have that can actually do the work with questions. If we can, as we're trying to build our partnerships even at UK, to find teams that want to do research that fits within what our group wants, yes, we want to partner with you. There's a whole new area that I've got people that we're going to start to work with in the health services research area, which is a whole new area of how do we be more effective and efficient in health services delivery. So we're always looking for partners to play with it.
Yeah, everyone's invited.
And students are great. I love working with students. Students do really good jobs, and you can do really nice, clean, small, defined projects. And if you do 4 or 5 small projects, they build up to a really good finding. And we've had our students presenting nationally many, many times at our national conferences. And actually, Megan's taken our stuff, has taken it international, and they've presented 2 presentations internationally on this work. So we're always looking for partners.
Yeah, I mean, it'd be really useful for us too to learn the process of doing that. There's a lot of our population of people with developmental disabilities.
Yeah, absolutely.
Probably we try to engage and haven't always done such a great job because we haven't involved them in the process of asking their own questions.
Yeah. Excellent question, though. Anything else? All right.
I think if we have no further questions, I'd like to thank Beth and Pat for sharing their experiences reaching out to rural underserved populations.
Thank you very much for the
Thanks.
opportunity to be here.
Yep, it was great.